What causes a urinary tract infection, UTI, in children? Imagine a tiny invasion happening inside your child's body that can make them feel uncomfortable or sick. That's what a urinary tract infection is. But what exactly causes these infections in children? Let's explore the facts. Most UTIs in children are caused by bacteria, tiny living organisms that can sneak into the urinary system. The main bacteria responsible is Escherichia coli, or E. coli, which normally lives in the intestines. These bacteria can move from the anus to the opening of the urethra, the tube that carries urine out of the body. If they reach the urethra and travel upward, they can infect the bladder or even the kidneys. This movement often happens when hygiene isn't optimal, like if a child wipes from back to front after using the bathroom, or if diaper changes are infrequent, allowing stool bacteria to stay near the urethral opening. Children are more prone to UTIs for several reasons. Girls are at higher risk because their urethra is shorter and closer to the anus, making it easier for bacteria to enter. Boys can also get UTIs, especially if they have anatomical differences that cause urine to back up or if they are not circumcised, which can sometimes make bacterial buildup more likely. Hygiene habits play a big role. Poor wiping techniques, such as wiping from back to front, can transfer bacteria from the rectum to the urethra. In infants and toddlers, not changing diapers often enough can leave stool near the urethral opening, increasing the chance of infection. Holding urine for long periods can also be a problem because it allows bacteria to multiply in the bladder. Encouraging children to urinate regularly helps flush bacteria out of the system. Not drinking enough fluids can lead to concentrated urine, which irritates the urinary tract and makes infections more likely. Constipation is another factor because hard stools can press on the bladder, preventing it from emptying fully. When the bladder doesn't empty completely, bacteria can grow and cause infection. In older children and teenagers, sexual activity can sometimes introduce bacteria into the urinary tract, but this is less common in very young children. Most UTIs start in the bladder, causing symptoms like pain or burning during urination, frequent urination, or lower belly pain. Sometimes, the only sign in babies is a fever without an obvious reason. If the infection spreads to the kidneys, it can cause more serious symptoms and needs prompt treatment. Diagnosis involves a simple urine test, and treatment usually includes antibiotics prescribed by a healthcare provider. It's very important to finish the entire course of medication, even if symptoms improve, to make sure the infection is fully gone and to prevent complications. Preventing UTIs involves good hygiene, regular bathroom visits, staying well hydrated, and treating constipation early. For children who get UTIs often, a doctor might do further tests to find out if there are underlying issues that need special attention. In summary, bacteria entering the urinary tract is the main cause of UTIs in children. Factors like hygiene, anatomy, habits like holding urine, and hydration all influence the risk. Recognizing symptoms early and seeking medical care helps prevent more serious problems. Always consult a healthcare professional if you suspect a UTI, as these infections need proper treatment and don't go away on their own.